Coronavirus, or well known as COVID-19, is an infection disease caused by the newly discovered coronavirus. COVID-19 affects different people in different ways. Most affected people will develop mild to moderate illness and recover without hospitalization. This pandemic has resulted in non-stop daily new cases across the world, including Malaysia. In COVID-19 pandemic, there are two defined individuals. The first one is COVID patients and the second one is called close contacts. COVID patient is an individual with a confirmed positive result of COVID-19. As a COVID patient, you need to be in the hospital for treatment or home isolation. Close contact defined as individual who had contact with someone who tested positive. As a close contact, you need to stay home for 14 days even though you don't feel sick. All close contacts either being contacted by KKM or by the employer required to be quarantined at home. There are many requests to stay home for quarantine, but how to track and monitor these people? There are existing applications that has been used in several countries to track the home quarantine people. Wristband known as TraceSafe IMSafe has been used in Canada, as well as in Hong Kong. While in the South Korea and China, both of them are using smartphone application. Until now, Malaysia still does not implement any specific applications to track the movement of home quarantine patients or individuals that need to stay at home. MySejahtera only offer guideline for home quarantine procedure, but there is no specific monitoring. Thus, the question here is how to help Malaysia in controlling the home quarantine patients or individual. Introducing to innovation called Pisah. Pisah is a COVID patient tracking system at home. It is a mobile-based application that can track and monitor the movement of the home quarantine individual within 14 days. Pisah is based from the Malay word pisah, which means separate or isolate. In the current situation of home quarantine, police will come to the house to check the status of quarantine people daily. However, with Pisah application, location will be recorded based on specific time and the police or the organization able to monitor the movement of individual from the personal dashboard only. Pisah is useful in solving issues of home quarantine in the perspective of, first, practicing strict monitoring to close contact defined by KKM. Second, organization can help stopping the spreading of COVID among their workers by doing self-monitoring to their own defined CC1 and CC2. Third, help the university to monitor the return students that needs to be quarantined inside the campus. Fourth, assist airport in managing the quarantine process for the travelers who enter Malaysia. And the last one, it provides the possibility to home isolation for COVID patients in answering the future ministry COVID-19 strategy. The readiness status of Pisah is now in TRL 6. The application is now ready for the full demonstrations in the relevant environment. Welcome to Pisah homepage. To use Pisah, first step, you need to sign up or register your home quarantine information. Second step, once the account is registered, you need to log in based on the registered information. Third step, you need to insert your home quarantine information. And finally, the apps will ask you to record your fingerprint. Fourth step is to setting your quarantine start date, and after that, your home quarantine profile is created. Once your profile created, you can access to 4 features in Pisah apps, which are tracking, diagnosis, dashboard, and start date. Diagnosis is health assessment tool that need to be taken by the home quarantine individual to assess their daily health status within 14 days. Tracking detect the current location of the phone and fingerprint. Start date will bring you back to the quarantine setting date, while dashboard will show you the movement record of your 14 days quarantines. To use Pisah apps, first you need to install the apps in your mobile phone. Next, you need to key in your login details, then the home page will be displayed. You need to click on the location and place your finger to record your fingerprint. Now your current location is stored in your personal dashboard. The tracking record of individual is displayed on the personal quarantine dashboard, which can be accessible by the registered organization. Organization will use Pisah applications as the role of employer. There are several benefits of implementing Pisah. Pisah is beneficial for minimizing the operation costs such as room setup, building or hotel rent, medical equipment, or food by KKM or organization. Second, Pisah is beneficial for cutting down the equipment tracking costs by only using the individual smartphone instead of other external trackers such as wristband tracker. Third, Pisah is also beneficial for reducing the cost of quarantine accommodation by travelers. Pisah can optimize the police routine checking for close contacts people and also allow the employer to record the movement of their workers for 14 days. To prepare Pisah for commercialization, there are 4 steps to do. First is to get the copyright. Second is to perform the market analysis and also to get the collaborators. Third is to design Pisah into market packaging and also to define licensing. And finally is to do the spin-off company and also to get the industry partner. The copyright status for Pisah is filing. Now, Malaysia has become second leading country with the highest confirmed cases over the previous weeks. It is a good opportunity for marketing Pisah as the demand for close contact is high. The current status is showing that near to 500,000 of POI or close contact in Malaysia by 21st May 2021 that has been ordered by KKM to be quarantined at home. In order to commercialize Pisah, potential users and collaborators has been identified as follows. The targeted group or users are Ministry of Health, public and private sector, airport and university. In terms of the technology transfer or collaborators, there are 3 parties that are interested to work with us. Department of Hospital and Management Unit at the Ministry of Health, Clinic SAIDI and National Research Councils of Italy. This is the letter of intent between the UMP and Clinic SAIDI and National Research Councils of Italy.
Hello everyone, I'm Dr. Hirman Ismail from the Ministry of Health Malaysia. And as we know that recently the Ministry of Health has announced that we are experiencing a surge of cases of COVID-19, especially those cases that are considered to be serious cases or critical cases that requires ventilator support and also oxygen support. And of course, any innovation or the use of technology that can help us to monitor patients at home, especially those cases which are considered to be having mild illness, category 1 and category 2, will be of great benefit to the physician, to the hospitals, because it would help the hospital to offload some of the cases in the hospitals and subsequently reduce congestion of the government hospital at the moment. So definitely innovation like Pisah can be of great benefit to the running of a healthcare system, especially during this pandemic.
As a conclusion, Pisah is suitable to be applied for tracking and monitoring the movement of home quarantine people. Pisah is now ready to be tested in the real environment at any organization. If you would like to have a further information about Pisah, please contact me at mazlina@ump.edu.my. Thank you for listening to my video. Have a good day.